But before we begin this hearing, I would like to welcome Congressman Klein to his first hearing as our new incoming ranking member from the Republican Party, the senior Republican on our committee, and welcome him to the committee in that position and say congratulations to him, and that I look forward to working with him to continue our efforts to rebuild our country and improve the lives of American families. Welcome, Mr. Klein.
Thank you, Mr. Chairman.
Congratulations to you. Today, as I said, we will examine the House Tri-Committee discussion draft for health care reform. This hearing marks the next step in our critical and historic effort to guarantee all Americans access to quality, affordable health care. No one can argue that our nation's current health care path is sustainable. Premiums and health care costs have skyrocketed for families and businesses alike. In today's system, insurance company bureaucrats hold all of the power. They get to decide whether to cover a care that a doctor recommends for their patient. They can deny coverage or delay treatment based upon pre-existing conditions, sending millions of people into devastating debt and prolonging anxiety or suffering from unattended care. Americans with health care are deeply concerned that their employer may scale back or even cancel their coverage. And if they lose their job, they will lose their health insurance too. The cost of 47 million uninsured people in our country is also unsustainable. The lack of coverage jeopardizes not only their personal health, but our nation's economic condition. The uninsured cost the rest of us about $1,100 per family in higher premiums. The numerous and serious weaknesses in our health care system have combined to deliver a crushing blow to America's families, businesses, and to our country's fiscal future. Last Friday, the three committees of jurisdiction in the House of Representatives unveiled our discussion draft for health care reform. It reflects months of hard work, of extensive meetings with Democrats and Republicans, with the senators, with Congressional Budget Office, with the administration officials and stakeholders, in an open and collaborative process. Consistent with President Obama's goals, our draft builds on what works and fixes what's broken in our current system. It lays the foundation for an American solution that will reduce costs, guarantee choice of doctors and plans, and ensure access to affordable quality health care for all. For Americans just beginning to pay attention to this health care debate, here are some critical ways that the reform will directly help you and your family. Our proposed reforms will cover about 95% of all Americans. If you like your doctor or your health care plan, you can keep them. You won't have to worry about coverage if your employer drops it or you lose your job. Co-pays for preventative care won't exist. Premiums or coverage will not be based upon pre-existing conditions, gender, or occupation. You will have a choice of high-quality, affordable public health insurance plan, and your doctors and nurses will have access to the best information organized in the best way to offer you individualized care. Our draft will help drive down health care costs in several ways. First, it ensures competition in the marketplace by establishing a new health insurance exchange that includes a strong public health insurance option that will compete on a level playing field to keep the insurance companies honest. This will help lower costs for everyone. Second, it trims costs by simplifying paperwork and preventing waste, fraud, and abuse. Third, and most importantly, it controls costs by reducing spending. These healthcare reforms will be fully paid for. President Obama has outlined a menu of cost reductions that we will consider and have to make some very tough decisions about. But this weekend's pledge by the pharmaceutical companies demonstrates that the President is successful in building a diverse coalition committed to reducing spending while improving affordability. Our draft outlines what other significant portion of this funding will come from, promotes efficiencies in Medicare and Medicaid, and ending overpayments to private plans. This does not mean that we will be cutting services. Instead, we will improve them and strengthen them in the long-term sustainability so we can continue to provide the quality and dependable health care service for years to come. Next, our reform will guarantee people a real choice of doctors, nurses, insurance plans through the exchange. Under our draft, as we said, if you like it, you can keep it. People who aren't covered will be able to choose a menu of affordable plans, both public and private. This coverage will be portable and guaranteed, no matter if an employer drops coverage or people lose their jobs. Finally, our draft ensures that all Americans can afford quality health care based upon a sliding scale. Every plan offered through the exchange will include essential benefits, including no copays for preventative service, coverage for dental and vision coverage for children, caps on annual out-of-pocket expenses that will protect against medical bankruptcy. It ensures that care will be as it should be, and that is patient-centered, driven by patients' needs and the expertise of doctors. It will simply not invest in utilization, but more so in outcomes. It invests in prevention and wellness. It ends the insurance companies' discriminatory practices. It also requires shared responsibilities by individuals, employers, and the government to ensure that all Americans have access to these benefits. In the coming weeks, we will continue to seek input from stakeholders and lawmakers, but many are also clamoring for inaction. Let me be clear on this one point. On behalf of every parent seeking care for their sick child, for every American hoping that health care costs are not their last stop before bankruptcy, I assure you that the one thing that seems to be, is in fact off the table in this effort is saying no to health care reform. To succeed, we will need the cooperation of all of our colleagues and of our President. There will be a tremendous pressure to think only about one narrow interest or another, but instead we must think about the future of our country and every American who expects that this year, this will be the year that we will make health care system part of America's shining future and not a cause of further financial chaos.